So yes, hello everyone. So let me just check, am I audible? Is the screen clear so that we can start the session? So let me just have a check. Okay. So yes, this is the session of Flexor and Extensor Retinaculum of the hand, in which I am going to describe the Flexor and Extensor Retinaculum of the hand, targeted for the MBBS students and also those who are targeting their NEET PG exam and next examination. It is an important topic, and the understanding of this topic is very important. So that is the whole scenario to understand this topic. So let me just have a look. I'm just checking, am I audible or not? Yeah. So yes, okay, I am audible. Okay. Okay. So myself, Dr.Monalisa, MD Anatomy from Forces Medical College Pune. Okay. So I have got a total of 9 years of teaching experience for the competitive exam, and for the MBBS students more than 11 years, 12 years. So this will be highly beneficial for you, which the topic I am teaching, because that is a very important topic, not only for your short notes as compared for your topics of MBBS, but also for the MCQs has been asked from this topic several times in the previous year. So this is an important topic if you are targeting your next exam also. Now special class features when I am talking. So tomorrow is Sunday, and definitely I want to utilize this session. So definitely I will come up with the special class on the Sunday. So that will be an interactive session. Polls are conducted among the learners. Raise your hands, get your doubts clear, and never ever miss a session. So once the session is finished, you can also download the PDF notes anytime, anywhere, read from the top educators of Unacademy platform. So these are the benefits of special free platform of Unacademy. You can have the benefits of these sessions. So you can be present for the live session. You can use the code ANAT10 and do present for this live session. That will be highly beneficial for you, or that would be highly beneficial for you, my dear aspirants. And also, if you start following me on the Unacademy app, you will get the notification of all the free sessions taken by me, and also the sessions, all the free session, and also you will get the notification of all my sessions, so that you are not going to miss any of the session. Now let's talk about the plus course, where the access to both live and recorded version is there. You can study from India's top educator. You can compete in live test and quizzes. You can study on the device of your choice, and you have an access to more than 25,000 MCQs. So these are the benefits which can be gained by you, and definitely you should go for it. It is highly beneficial for you. Now when I am talking about iconic subscription, it means both the Unacademy and Prep Ladder benefits can be assessed by you. So both the benefits can be gained by you, that is the Unacademy and the Prep Ladder. So already talked about the benefits of the plus course: well structured live batches, recorded version, full syllabus, Q bank, 25,000 new highly effective Q banks, which is targeted on the recent pattern of examination MCQs, competitive live test and quizzes. Other than that, you can have the benefits of clinical integrated essentials, video lectures of the dream team of the Prep Ladder. You will also be provided with the printed notes of the Prep Ladder, rapid revision, snapshots, and Q bank 3. All these can be assessed by you. Congratulations to the toppers of FMGE December session 2021. I wish them best of luck, so that they can target their examination, their competitive examination, which they are appearing, so be cracked by definitely a very good rank, and all the best to them. NEET PG free test calendar has been shared with you. The upcoming batches information I want you to give, so that it will help you to guide in taking the plus course. And I definitely want you to take the plus course if you are targeting your examination and you to want to go in a very systematic way. You should go for plus course. You can be a part of Focus FMG batch, you can be a part of Mission INI-CT batch, you can be the part of High Yield MCQ Marathon batch, or NEET PG 22 All India Educator Revision batch. Also, before starting the session, have a look on the Plus and Iconic subscription. The comparison of Plus and Iconic has been shown. This will help you to decide whether you should go for Plus or Iconic subscription. Take this subscription, use my code for getting an extra discount of 10%. So all the best. And also the students can use this code for ANAT10 for be present for my session of free special class on the Unacademy platform. So let's start with the topic today, that is Flexor Retaniculum. Flexor Retaniculum. Okay, so my dear aspirants, actually in general anatomy जब ये topic था तो there was a retinaculum topic which I have told you. D fascia का class था जिसमें मैंने बोला था जो flexor और extensor retinaculums होते हैं, that is on the palmar and dorsal aspect, and these retinaculum is a strong fibrous band which is bridging the anterior concavity of the carpal bone and converting into a osteofibrous tunnel. So it is converting into it the space into osteofibrous tunnel called as carpal tunnel for the passage of tendons, flexor tendons and also median nerve. So my dear aspirants, the retinaculum, so here if I enlarge this diagram, you can see clearly the Flexor Retaniculum, which is also called as, so you can see here, this is also called as transverse carpal ligament. Okay, so this is the modification of deep fascia and it is keeping all the tendons. So you can see here the flexor tendons which is passing from forearm and going towards the palm. So all the tendons are not getting separated because of this Flexor Retaniculum which is attached medially and laterally to the carpal bones, and this is holding. So it's a modification of deep fascia and it is bridging the anterior concavity of the carpal bone and converting into osteofibrous tunnel through which many of the flexor tendons and median nerve is traversing. So Flexor Retaniculum, firstly I would like to write the definition and then I would also like to give you the details of its attachment. Flexor Retaniculum, it is a strong fibrous band modification of deep fascia bridge the anterior concavity of, it is bridging the anterior concavity of carpal bones and covering it and forming it into osteofibrous tunnel, and through this osteofibrous tunnel the flexor tendons traverse, along with the flexor tendon median nerve also traverse through this osteofibrous tunnel. Okay, now my dear aspirants, now there is another diagram also where you can appreciate this. So let me just enlarge this diagram. So yes, if I am enlarging it, you can clearly see the Flexor Retaniculum. This is the Flexor Retaniculum. What I told you, it is attached on medial and lateral carpal bones. So on medial, if I talk about medial aspect, so this will be, this side is M for the medial, this side will be L for lateral. So medially it is attached to hook of hamate and that of pisiform carpal bone. Laterally it will be attached to the scaphoid and trapezium carpal bone, and this whole band which you are seeing is the Flexor Retaniculum, which is also called as transverse carpal ligament. So clearly you can see below the Flexor Retaniculum, the structures traversing is the tendons of Flexor digitorum superficialis, the tendons of Flexor digitorum profundus, and also Flexor pollicis longus. So these are the tendons which is traversing. I would like to make a diagram, and also median nerve is traversing below it, but not the ulnar nerve and that of ulnar artery which is passing superficial to it. So for understanding this topic, it is important that we should make a diagram by I will make a diagram, you can also make that diagram and you can understand the details of Flexor Retaniculum. Here we are seeing the tendons and median nerve is traversing below it. Some of the structures are passing above it as median nerve is traversing below Flexor Retaniculum through this osteofibrous tunnel which is called as carpal tunnel. So there can be at times compression of median nerve below fibrous retinaculum, and that condition is called as carpal tunnel syndrome. So let's see this again. Here you can appreciate this fibrous attachment. This is the transverse carpal ligament which is also called as the Flexor Retaniculum. Median nerve, you can clearly see this is the median nerve which is traversing below it. And along with the flexor tendon. So let's see about the attachment. So I would also like to write firstly attachment and then I will draw the diagram. So write on the heading attachments of Flexor Retinaculum. Okay, so medially, as I told you, medially it is attached to which carpal bone? It is attached to pisiform carpal bone, the smallest carpal bone, and that of hook of hamate. If I talk about its lateral attachment of transverse carpal ligament of flexor retinaculum, laterally it is attached to the lateral carpal bones, that is, it is attached to the tubercle of scaphoid carpal bone and crest of trapezium. So, this is all about the attachment of flexor retinaculum. Now, for understanding the structures which is traversing below it and above it, I would like to draw a diagram. So, all of you, so for that I will just enlarge this, I am taking a clean sheet, white background, and then you can draw the diagram along with me. So, we will draw, so this is it, this diagram is actually, if I, yeah. So, this diagram is actually, here you can write down the heading, it is a transverse section at the level of wrist showing carpal tunnel structure. Showing what? Showing carpal tunnel structure. So, it is showing carpal tunnel. It is showing the space below the flexor retinaculum is carpal tunnel. So, yes. So, we are drawing the diagram, and now let us make a diagram for it. So, first I am just making an outline of few carpal bones. Okay. Yes. Now, my dear aspirants, after that, on one side, now I would like to make the retinaculum. The retinaculum, more or less, it's having a shape of Y shape like this. So, this is what I am making. This is the retinaculum. This is the flexor retinaculum, which is also called as, this is the flexor retinaculum, which is also called as transverse carpal ligament. Okay, so this is the outline which I am making. Okay, so done. Okay, now thereafter, on one side just a muscle hype here and another muscle hype here. So, this will be nothing but thus the thenar and hypothenar muscle. So, one side we will have the on the medial side hypothenar muscle and on the lateral side thenar muscle. So, just to have a idea of medial and lateral side. Okay. Okay. So, yes. So, you can just write here. It's a thenar and this is the hip of hypothenar muscles. Okay. Bulk, noting. See. Now, so this is flexor retinaculum. So, this is clear that this is the flexor retinaculum, this is flexor retinaculum. Now, one more thing I just want to draw with green color only, that is the superficial slip of flexor retinaculum. So, this is the superficial slip of flexor retinaculum. Okay. So, what is this? This is superficial slip of flexor retinaculum is called as volar carpal ligament. And just below volar carpal ligament we have got one artery is traversing and the other one is the nerve which is traversing. Okay. So, one artery and one nerve. See here, this is the, so we have got here the artery and the nerve traversing. So, here this will be the UN for ulnar nerve and this is UA for ulnar artery. Got it? Now, so now let us see the structures lying below or passing in this osteofibrous tunnel, that is carpal tunnel. Okay, just I want to show that volar carpal ligament is a superficial slip of flexor retinaculum itself, and below that the ulnar nerve and ulnar artery is traversing. That means they are moving, they are passing superficial to flexor retinaculum. Now, so let us make the tendons. So, here one tendon. So, let me use a different color. Yeah, this is the tendon which is traversing below it. Okay, these are the muscle tendon which is traversing. Okay, now here is this tendon. I want you to write, this is FCR. This is FCR, that is flexor carpi radialis. So in this diagram you can appreciate that flexor carpi radialis is passing between the two slips of flexor retinaculum. It is passing between the two slips of flexor retinaculum, neither above and nor below flexor retinaculum. The other muscle tendons, which is, so these are the tendons of FDS and these are the tendons of FDP, and this is FPL, flexor pollicis longus. So flexor, that means flexor pollicis longus, that means the tendons of flexor pollicis longus, the tendons of flexor pollicis longus, the tendons of FDP. So this is the tendon of FDP. So the tendon of FDP, flexor digitorum profundus, and FDS, flexor digitorum superficialis tendon is passing below the flexor retinaculum, that is carpal tunnel, and the nerve, a thick nerve also traversing below it. The nerve which is traversing below it is the median nerve. So this is which nerve? This is MN for median nerve. So this is median nerve. So median nerve is also traversing. Median nerve is also traversing below flexor retinaculum. Now the structures which is passing superficial to that of the flexor retinaculum. So two structures already done, that is the ulnar nerve and the ulnar artery as we move from medial to lateral. Other than that, we have got palmar cutaneous branches, two palmar cutaneous branches of median nerve and that of ulnar nerve, and in between we have got one of the muscle, that is the tendon of palmaris longus muscle, and laterally we have got one of the superficial branch of radial artery. So let's name it, everyone. Okay, so see here, this is palmaris longus muscle, PL, and this is the palmar cutaneous branch of median nerve. Okay, this is palmar cutaneous branch of ulnar nerve, and this is superficial branch of radial artery, superficial branch of radial artery. So is it done? So in short, we have done with this diagram where we are seeing the structures which is passing superficial to flexor retinaculum and the structures which is passing deep to flexor retinaculum. Any doubt? Any doubt, everyone? So you can clearly see the structures passing superficial and deep to flexor retinaculum, as you can see from medial to lateral. Okay, so here many of the MCQs can be solved by you, as FCR, this has been asked so many times in the MCQ. The important point about this is that has been MCQ, that FCR is one of the muscle tendon which is neither passing above or below the flexor retinaculum. As you can see, if flexor retinaculum is Y shaped, the gap between that two slips of flexor retinaculum, the structure is passing. Ulnar nerve and ulnar artery passing superficial. As you can see, both these two structures are passing superficial to flexor retinaculum, but they are covered by volar carpal ligament. And median nerve and flexor tendons FPL, FDS and FDP are passing along with median nerve below the flexor retinaculum, that is carpal tunnel. So we have done with this. Now my dear aspirants, let's move on to the next one, that is extensor retinaculum. So everyone, is it clear? Can we move on to the next one, that is extensor retinaculum? So if you want, I can write the list also. So all of you please have a look on the list of the structures passing. So write down structures passing superficial to flexor retinaculum. Which are the structures which is passing superficial to flexor retinaculum? Ulnar nerve, ulnar artery, palmar cutaneous branch of ulnar nerve, tendon of palmaris longus muscle, tendon of palmaris longus muscle. The fifth structure is palmar cutaneous branch of median nerve, and the lateral most structure is superficial branch of radial artery, superficial palmar branch of radial artery. So is it okay? So these are the structures as we move from medial to lateral. So these are the structures as we move from medial to lateral, passing superficial to flexor retinaculum. This is one. Now it is also important that you should know the structures which is passing deep to flexor retinaculum. So the second point is structures passing deep to FR, that means deep to flexor retinaculum. So, the structures are tendons of FDS, tendon of FDP, median nerve and tendon of FPL, flexor pollicis longus. So, FCR is not passing, it is not passing below. So, please that is clear that it is not passing below or superficial to that of flexor retinaculum. FCR, flexor carpi radialis, this is passing through the gap between flexor retinaculum. That was the point which I wanted you to be clear. So, we have done with this. Now, my dear aspirants, I would, so we have any doubt, please let me know. Any doubt? Any of the students or aspirant is having any doubt, please let me know. Okay. I also want to tell about extensor retinaculum. Now, same way as we have studied about flexor retinaculum on the dorsum aspect. So, actually it is a deep fascia on the back of the wrist, that is called as extensor retinaculum, and it is approximately 2 centimeter broad. So, you can see here this is the dorsal aspect of, as you can see, this is the dorsal view, and here this is called as dorsal carpal ligament also. The other name of extensor retinaculum is dorsal carpal ligament. So, this is the dorsal carpal ligament or the extensor retinaculum, which is again a modification of deep fascia. It is lying on the back of the wrist and it is also thickened to form an oblique fibrous band, that is called as extensor retinaculum, modification of deep fascia, and it is approximately 2 centimeter broad. Okay. Now, after that, I would like to tell about the attachment. So, before starting with the diagram, and here also for extensor retinaculum also I want to make a diagram. So, but before that I want you to tell about its attachment. So, please write down medial attachment. If I talk about medial attachment of extensor retinaculum, it is attached to following structures. It is attached to the stelloid process of ulna, and medially two other carpal bones. One is again pisiform and the other is tricuetral. So, it is attached to tricuetral carpal bone and that of pisiform carpal bone. It is attached to tricuetral and that of pisiform carpal bone medially. Now, coming to the next lateral attachment. So, when we are talking about lateral attachments, lateral attachment of extensor retinaculum is on to the lower part of the anterior border of radius. So, it is attached to the lower part of anterior border of radius bone. So, done. So, this is all about the attachment of extensor retinaculum. Medially attached to the ulnar bone stelloid process and to that of tricuetral and pisiform laterally to the lower part of anterior border of radius bone. Now, my dear aspirants, another important point is the compartment. So, this has been asked in the previous year NEET PG examination also, and the space lying deep to extensor retinaculum is divided into 6 compartments. Okay. And we have to know that what extensor tendons are kept together and these extensor tendons are passing deep to it. So, let me just enlarge this. So, first thing is the extensor retinaculum, which is clearly seen here. So, what I told you, the extensor retinaculum is bridging on the dorsum aspect of the hand and keeping all the extensor tendons together where they are diverging and going towards the metacarpal phalanges, as you can see here. Okay, so you can see here 1, 2, 3, 4, 5, 6 has been written. Why it is written? Because deep to extensor retinaculum. If we talk about deeper aspect of extensor retinaculum, so deep to extensor retinaculum, there is formation of 6 compartments, and through these 6 compartments the structures are traversing. So, why it is important to know? There is actually there is deep to it, there is an space, and these space are divided into compartments by, so just deep to retinaculum there is 6 compartment, and the structures passing through this 6 compartment is important for us to know. So, you can see here these are the compartments. This is the So you can see here the outline of the radius and that of the, so this is the radius bone and this is the ulnar bone, and on the dorsum aspect you can see 6 compartments are there and the structures passing through the individual compartment has been shown here. So here you can see through the first compartment the structures traversing is extensor pollicis brevis and abductor pollicis longus. Second compartment ECRL and ECRB, extensor carpi radialis longus and brevis. Third compartment just one tendon, that is extensor pollicis longus. Fourth compartment we have got 4 structures, only tendons has been shown here, that is extensor digitorum and extensor indicis, but other than that anterior intraosseous artery and posterior intraosseous nerve also traverses. Fifth compartment extensor digiti minimi and sixth compartment extensor carpi unlaris. So my dear aspirants, I would like to make this diagram. So again you make this diagram with me so that you can better understand this. So we are going to make the extensor compartment. Okay, Ravi Kumar. So let's start with the making diagram. Okay, so let's start with making diagram and it will be useful for you. Okay, so that is so we will come to that. Let me firstly complete this topic and then again. Okay, I have seen your message, Ravi Kumar, but I would like firstly to come up with the explanation of this topic and then we will have the discussion. Okay, so what I have told you, let's make a diagram showing you the extensor compartment and the structures traversing. So transverse section of the forearm just above the wrist showing extensor compartment. So we are making a diagram showing extensor compartment. Okay, extensor compartment. Now, so I would just like to make this outline of radius and ulna. So this is the radius bone and this is the ulnar bone. And with green color I would like to make the extensor retinaculum. Okay, so this is the extensor retinaculum which I have made. How many compartments? 1, 2, 3, 4, 5 and 6. So we have got, this is the first compartment, this is the second one, this is the third, this is the fourth, this is the fifth and this is the sixth. Now we have to know the structures residing in individual compartments. So 2 tendons in the first compartment, 2 tendons in the second one, just a single tendon in the third one. This is schematic diagram to make you understand. So if I talk about the fourth one, it is having 4 important structures. Okay, so done. So yes, these are all tendons which I have made. Now let's come up with the labeling. So extensor compartment, this extensor transverse section is done at the level of the forearm just above the wrist, showing the extensor compartment and the structures traversing. So when I am talking about the first compartment, the structures traversing is APL, that is abductor pollicis longus and extensor pollicis brevis. I have written in short form, it is abductor pollicis longus and extensor pollicis brevis. Now coming to the second compartment, it is ECRL and that of ECRB. What is it? Extensor carpi radialis longus and extensor carpi radialis brevis. Third compartment, just one tendon, EPL. Fourth compartment, it is ED, extensor digitorum, extensor indicis and one artery and one nerve. Okay, so we have got, this is anterior intraosseous artery, this is anterior intraosseous artery, anterior in introosseous artery, and the nerve, here itself I will write pin, posterior introosseous nerve. The nerve is pin. Which nerve is this? This is the pin nerve. So it is PIN, pin nerve. This is extensor digiti minimi, and this is ECU, extensor carpi unlaris. So this is a diagram showing extensor compartment and the structures traversing through the individual extensor compartment. Okay. So for your examination point of view, why it is very important, because so many times it has been asked the structures traversing through the third extensor compartment, fourth extensor compartment. So it is important that we should know all the structures traversing through the individual extensor compartment. So done with it. This is the diagram just to make you understand, and this is the exactly the extensor compartment. This is the extensor retinaculum. Below the extensor retinaculum, the space is showing the extensor compartment and the structures passing through individual extensor compartment. Compartment 1st to 6, it is important that you should know. Okay. So that is from lateral to medial. So we have got from lateral to medial. Now my dear aspirants, I would also like to show you this cadaveric image. If I am showing you this cadaveric image, you can again appreciate here. This is the extensor retinaculum which has been shown, and below it the tendons all traverses. So various tendons are traversing, extensor indicis, extensor pollicis, extensor carpi radialis longus, brevis, extensor digiti minimi, extensor digitorum. So clearly you can appreciate the extensor. So all the extensor muscles which is traversing and reaching towards their insertion point and going towards the dorsum of the hand and passing through the insertion point, they will pass below the extensor retinaculum in the individual compartment separately. And it is important for us to know the individual compartment structures traversing. So here also one more diagram has been shown. So my dear, this is a transverse section where you can appreciate not ulna the, you can appreciate here the extensor compartment, also the flexor one. So you can see here, this is the outline of radius and ulna which has been drawn, and you can see the structures passing through individual extensor compartment has been shown, and on the other aspect the flexor retinaculum and the structures traversing below it. So here also you can see the flexor compartment structures. So in a single diagram you can see this is a transverse section. In a single diagram you can have a look on all the extensor compartment, you can have an idea of all the extensor compartment traversing and also the flexor structures traversing. Okay. So here this space will become the carpal tunnel. This is the carpal tunnel space. Okay, and these are the structures which is passing superficial ulnar nerve and ulnar artery, and this whole is the extensor compartment and the structures passing through that extensor compartment. Now before ending this session, I would like to show you that NEET PG free test calendar is there, and upcoming free NEET PG test or any of the tests which is on the platform of Unacademy, you can enroll by using the code NAT10. Also, I want you to tell that the students who are interested for the free sessions, whether on the Plus or Iconic, they can definitely join it. They can see this pricing detail of the Plus and Iconic, have a comparison of it, and you can also use my code NAT10 and get an extra discount of 10%. This will be highly beneficial for you, and you can be the part of this session. And also tomorrow is Sunday, so definitely I will take sessions tomorrow on Sunday. The link of the session will be provided in the Telegram group of Future Doctor and Unacademy Future Doctor, and also in Telegram group of Let's Crack NEET PG. All the Unacademy Telegram group, the links are provided beforehand. So do present live, get enrolled for the free sessions by using the code NAT10. The link will be provided beforehand, don't worry. And thank you, all the best, keep studying, and we will again meet with the upcoming session. So definitely I will keep the sessions exactly in the afternoon 12 and 1. So thank you, all the best. So in the afternoon I will keep the sessions. Thank you, and do like, subscribe the channel, and be present, and you can get enrolled for my free test and free sessions by using the code NAT10. So do like, subscribe, and when you are attending the session on the Unacademy platform, free or plus any of the session, you can absolutely get the PDF notes once the session is finished, so you can download it. Yes, so yes, so trying radiology, okay, sure dear, you can take help for the anatomy subject with me, Ravi, and definitely it's a personal choice. Whichever branch you like, you should go for it. Definitely you should give a second try. All the best. Keep studying. Thank you so much.